Good morning, my dear students. Today we are going to discuss about forensic psychiatry. What is forensic psychiatry? What does a medical practitioner need to do in a forensic psychiatry? It's not a duty of a psychiatrist or it's not a duty of a medical person. It is a duty of a forensic expert who can help the law enforcing agencies as well as the psychiatry people, as well as the medical people in treating a psychiatric patient, discharging a psychiatric patient from a psychiatric hospital, or else finding out the role of a person in a crime. Mental illness is solely a sociological concept accepting according to a mentally ill person may be designated as that member of the community who is unable to look after himself or manage his own affairs or is dangerous to himself or to the others. It is very clear that a person who is unable to perform his own duties on a psychological basis and he is dangerous to himself as well as to the society, this person is termed as mental illness person. Certifiable mental illness or legal insanity. The mental illness may be such as a gravity that it becomes advisable in the interest of the patient or the community to segregate such an individual and deprive him of his liberty and his rights as a citizen. Whenever a person is found to be mentally ill or mentally unsound, that person should be kept in a mental asylum and he has to be separated from the rest of the community so that he should not damage other people. Other people's rights have to be protected and then his rights have to be minimized so that others are not affected by that person. The term insanity is loosely used to refer any mental disorder or mental illness. However, it is commonly used in legal contexts such as insanity defense. The IPC employs the term unsoundness of mind while referring to insanity. Rather than calling a person who is insane, we can better call him as a mentally unsound person. Forensic psychiatry is a subspecialty of psychiatry which deals with the application of psychiatric knowledge to the legal issues. For example, a person has committed a crime and to know whether this person is mentally sound to know the outcome of that crime or not is the duty of a forensic psychiatrist. In general, it represents an interference between law and psychiatry. Role of a forensic psychiatrist in criminal cases. Crime committed by a person in a state of mental unsoundness makes him a defense. This point acts as a defense for him whenever he commits a crime. But he cannot predict or he cannot act that he is insane. His insanity can be proved beyond doubt. Inability to plead defense during the trial. A convicted criminal files a petition to defer the punishment. Whenever a person is being committed and he has been proved guilty of the crime, but he can file a petition to extend the date of start of the punishment. Suicide, abetment to suicide and rape of an insane woman. These are all the points which we are going to discuss today. Role of a forensic psychiatrist in civil cases. Testamentary capacity. The forensic psychiatrist has to certify that whether a person is in a sound state to give a testament capacity. Continuation of dissolution of a business. Nullity or divorce of a marriage, to act as a witness, consent, appointment of a curator or a caretaker. In all these cases, forensic psychiatrist plays a vital role. Mental Health Act or MHA Act 1987 replaced Indian Lunatic Act 1912. MHA is divided into 10 chapters consisting of 98 sections. Chapter 1 deals with the definitions of various mental illness. Mental ill person is the one who is in need of treatment by reason of any mental disorder other than mental retardation. You have to differentiate between a mental illness as well as a mental retardation. Mental Health Act 1987 replaces the Indian Lunatic Act 1912. Asylum, a psychiatric hospital or a nursing home where a psychiatric patients are treated. Lunatic, mental ill person or mentally challenged person. Criminal lunatic, mentally ill person with a crime activity is called a criminal lunatic. Psychiatric hospital or nursing home is a hospital for the mentally ill maintained by the government or private authority with the facility of outpatient treatment and registered with appropriate license authority. Admitting a mental ill person to a general nursing home is an offense. Medical officer, a gazetted medical officer in government service appointed by the state government. Medical officer in charge, medical officer who for the time being is in charge of a psychiatric hospital is a medical officer in charge. Medical practitioner, a person with recognized medical qualification under the provision of the act is called as a medical practitioner. Psychiatrist, a registered medical practitioner with postgraduate or diploma in psychiatry recognized by the Medical Council of India. Mentally ill person, a person suffering from mental disorder or other than mental retardation is called mentally ill person. Reception order, an order for admission and detention of a mentally ill person in a psychiatric hospital or a nursing home is called a reception order. Mentally ill prisoner is a mentally ill person ordered for the detention in a psychiatric hospital, jail or other safe custody. Classification of insanity. Till now we have discussed about various acts and definitions as per the acts. Now let us discuss about the classification of the insanity. Organic disorders, affective disorders, psychosomatic illness, compulsive conditions and others. Organic disorders are again divided into acute and chronic. Acute or delirium, toxic confusional status, whereas chronic is degenerative, epileptic, metabolic and infective and neoplastic. Affective disorders are mood involving mania, melancholia and anxiety states. Psychosomatic illness, considerable role of emotional and physical factors. Compulsive conditions, obsession, impulse or the compulsive conditions. Others, schizophrenia, hysteria, personality disorders. Classification of insanity again. Disorders of thought, they are delusion, impulse, obsession and phobia. Disorders of consciousness, delirium and fugue. Disorders of perception, hallucinations and illusions. Disorders of personality, psychopath or schizophrenia. Psychosis, neurosis and affective disorders. Disorders of thought. Let us discuss more about each type of psychiatric conditions. The first one is the delusion. False belief in something which is not a fact. Delusion persists even after the fact, the falsity is clearly demonstrated. It is well known that physically a person is normal, but mentally is unsound. For example, this pen is there in my hand. He feels that even if the pen is not there in my hand, he feels that it is available in my hand. He thinks that it is available there. That is called delusion. Types of delusion: grandeur or exaltation, persecution, reference, influence, infidelity and self-reproach. Nihilistic, hypochondriac and erotomania. Impulse: sudden irresistible force compelling a person to the conscious performance of some act for which there is no motive for or forethought. A sane person is capable of controlling an impulse, whereas an insane person cannot control his impulse. Types of impulses: kleptomania, pyromania, nutulomania, dipsomania, sexual impulse, and suicidal and homicidal impulses. Obsession is a disorder of the content of thought. A single idea, thought or emotion is constantly entertained by a person which he recognizes as irrational but persists in spite of all efforts to derive it from his mind. Any attempt to resist makes them appear more insistent, and yielding is the inevitable outcome. Borderline between sanity and insanity. Usually, this is the condition in which the person is turning from a sane personality to insane personality. Usually occurs in neurotic people who are able to discharge ordinary responsibility of life. Phobia: an excessive or irrational fear of a particular object or situation. There is nothing in true which is making him to fear about that, but the person fears a lot about that. Claustrophobia, that is fear of staying in a closed place. Nyctophobia, fear of darkness. Agoraphobia, fear of open space. Acrophobia, fear of height. Mysophobia, fear of dirt. Hydrophobia, fear of water. Disorders of consciousness, delirium. Disturbance of consciousness in which orientation is impaired. Thought content is irrelevant or inconsistent. In the early stages, the patient is restless, uneasy, and sleeplessness. Later, he loses self-control and becomes excited, and talks furiously. Delusion and hallucinations may be present. He becomes impulsive. Usually occurs in physical diseases like continuation high fever or mental stress or drug intoxication. Fugue: a state of altered awareness during which an individual forgets part of the whole of his life, leaves home and wanders away. He has a state of complete amnesia for the period. Occurs commonly in hysteria and also in depressive illnesses, especially seen in schizophrenia. Disorders of perception, that is hallucinations. Hallucination is a false sense perception without any external object or stimulus to produce it. This is purely imaginary and may affect any or all of the special sensory functions. Visual hallucinations, auditory hallucinations, olfactory hallucinations, gustatory hallucinations, tactile hallucinations, and psychomotor hallucinations. Illusion. Illusion is a false interpretation by the senses of an external object or stimulus which has a real existence. In hallucination, there is no real existence, but in illusion, it is existing. Something is existing, but the person's perception is different. Personality disorders, psychopath or sociopath, a person who is neither insane nor mentally defective, but fails to conform to the normal standards of life behavior. Psychopath have abnormal personality, persistently behaves in an antisocial or disruptive manner. There is a failure of maturation of the personality, the individual retaining a childlike selfishness. There is no abnormality of thought, mood, or intelligence. It is not a ground for insanity, defense, but may provide a plea of diminishing responsibility. Psychopathic disorders, it is a persistent disorder or disability of mind which results in abnormal, aggressive, or seriously irresponsible conduct on the part of the person. Psychopathic disorders causes adverse surroundings during the period of upbringing, deficiency and defects in personal education and training, weak and inconsistent training and rearing during childhood, excessive frustration. Henderson's classification: aggressive, inadequate, and moral and mental defect. Schizophrenia. It is a condition of split personality in which the patient loses his contact with his environment, primarily a disorder of thinking, later develops into other disorders. Disorder of behavior, disorder of thought, disorders of affects, delusions, hallucinations, and personal deterioration. These are all the components of the schizophrenia. Simple hypophonia, catatonic, and paranoid. Characterized by a withdrawal from reality and living in a world of fantasy. Mental illness supervene upon a normally developed mental faculty. There is disorientation in the personality and progressive loss of contact with the reality. Neurosis. The patient suffers from emotional and intellectual disorders but does not lose in touch with the reality. Commonly seen in anxiety, depression, or hysteria. The effect may be mild or may cause considerable disturbances. Affective disorders affect emotion, feeling, or mood. Affective disorders. Psychiatric disorder in which the chief feature is a relative prolonged affective change of an abnormal degree. Mania or melancholia means depression. Alcoholism and psychosis. Alcoholism is a certain fact which is surely associated with some psychological components. Alcoholic blackouts, wherein a chronic alcoholics, you will see suddenly the alcohol person loses continuation with the surroundings, that is called alcoholic blackouts. Delirium tremens, alcoholic hallucinations, Korsakoff psychosis, Wernicke's encephalopathy, and delusion of jealousy. These are all the different types of alcoholic psychosis. Alcoholic blackouts, these are episodes of amnesia. They will forget everything. Certain part of their life, they forget everything. They don't remember any part of that situation. Alcoholic delirium tremens usually occurs in chronic drunkards 1 to 2 days after sudden withdrawal due to heavy drinking. Usually they will have episodes of heavy drinking of alcohol, and after 1-2 days of sudden withdrawal they develop this alcoholic delirium tremens. Injuries, infection and shock as precipitating factors. This patient becomes sleepless, restless and irritable, then develops disorders of perception and coarse muscular tremors of face, tongue and hands. He commits suicide or murder or assault. Alcoholic hallucinations. The patient may suffer from illusions and hallucinations. Korsakoff psychosis, characterized by loss of memory for recent events, both retrograde and antegrade. The individual remains responsive and alert despite the severe memory and learning impairment. Wernicke's encephalopathy. The physical components of Korsakoff psychosis consist of ophthalmoplegia, ataxia and peripheral neuritis, and is known as Wernicke's encephalopathy. Delusions of jealousy will be there in this. General paralysis of insane, usually associated with meningovascular syphilis and Tapes dorsalis. Chronic psychoorganic syndrome, characterized by temperamental and personality changes leading to paralysis and dementia. Memory impaired, thought retrograde, and they lose all types of memory. Epileptic psychosis. Pre-epileptic conditions are stated with confusion. Post-epileptic automatism and psychomotor epilepsy. These are temporal lobe epilepsy, masked epilepsy and psychic epilepsy. Pregnancy, childbirth and psychosis. Psychosis may occur any time from the beginning of the pregnancy to the end of the lactation. Delusion and dislike or hatred towards the husband may occur, and the patient may develop suicidal tendencies, and in some cases you will find homicidal tendencies also. Postpartum psychosis may take a great variety of forms. The common being mania, infanticide may become committed. Lactational psychosis may occur after 6 weeks of confinement, characterized by mental confusion, hallucinations and depressions. Delusion of persecution may develop, which may lead to suicide and infanticide. Somnambulism, that is sleepwalking. The person walks while during the sleep. Suddenly he wakes up from the sleep and then he walks around somnolescent, sleep or drunkenness. Midway between sleep and waking, he may commit crime due to confusion of the mind. Lucid interval, period of sanity in between two periods of insanity or bouts of insanity. All the symptoms of insanity disappear and the person is completely normal during this period. He can make a valid will during the period of this period and responsible for all his acts. Lucid interval in an insanity as well as you can see it in a head injury. The history in the insanity is very clear, whereas in the head injury history is very clear. Preceding symptoms of insanity are present. Symptoms of concussion are present. Following symptoms of insanity, whereas here in the mental head injury, cerebral irritation and brain compression will be there. Occurrence frequently, but whereas occurrence here only once in a head injury. Causes of insanity: hereditary, environmental and psychogenic. In the hereditary, Huntington's chorea and family idiocy are the most common ones. Because of the environmental things, faulty parental attitude and a lack of mental hygiene, this will result in the environmental insanity. Psychogenic, unsuccessfully responsive, repressed mental conflict. Precipitating financial worries, frustration and disappointment in sexual affairs or death of close relatives, etc. Organic head injury, atherosclerosis, senile degeneration, myxedema and pernicious anemia. Diagnosis of insanity. It is very critical how to diagnose an insane person, and the diagnosis should be 100% false proof. You cannot miss a diagnosis of an insane person. In typical cases, the diagnosis is easy, but in early stages and in borderline cases, the correct diagnosis becomes very difficult. The objectives of clinical examination are to form an opinion about the patient's mind and the degree of responsibility. Preliminary particulars: a family history, a personal history and other drug history. In the family history, you need to elicit if there is any psychosis, chorea or epilepsy, etc. in the family. In the personal history, previous mental illnesses and treatment, environmental factors, emotional conflicts and anxiety, drugs, frustration in life and love, etc. has to be ascertained. Manner of dress and walk are very important to find out how far the person is insane. Examine for deformities and disease. Pulse and temperature may be increased. Tongue, fur, skin dry and wrinkled. Talk, mutism or distraction or irrelevant. Speech, incoherent, slurring and stammering will be there. Writing, flight of ideas, insulting language and unintelligible. Behavior, lazy, impulsive or stereotypic or echopraxia. Mood, emotional, euphoria, joy, anger, apathy, irritability, etc. All things will be available. Memory, sometimes they have a good memory and sometimes their memory is lost. Sleep, insomnia, hyposomnia or somnambulism or somnolentia will be present. Walk and gait, most of the times they are normal or sometimes are abnormal. Sexual behavior, most of the times normal or sometimes maybe abnormal. Attention is lost. Thought process and thought content is irrelevant. Investigations, blood, urea, CSF, X-ray, EEG, etc. has to be done. Observations, you have to take care of everything, right from the physical findings, from the history and all other signs and symptoms. Certification, 3 examinations and on different days and different hours have to be done to certify that the person is insane. True insanity versus finged insanity. It is very important to identify a true insane person to give a proper judgments, and we should always find out a finged insane person, and he should not be given benefits in the judgments. In a true insane person, the insanity is of gradual onset, whereas in a finged insane, it is a sudden onset. No motive is present in the true insanity, whereas present in the finged insane. Predisposing factors are present in true insanity. Signs and symptoms are uniform, and face is vacant looked, and insomnia or exhaustion are present in a true insanity. There are no predisposing factors in a finged insanity. Signs and symptoms are present on when observed by the others, rather than if they are not observed, that somebody is observing them, you will not find the signs and symptoms. And the face in a finged insanity is frequently changing, whereas in a true insanity, it is always vacant look will be there. Restraint of insanity. Immediate restraint. When he is dangerous to himself or to others or to society, when who is likely to injure or wasteful spend his money, then he should call as a restraint of insanity. Person suffering from delirium due to disease or delirium tremens. Admission in a psychiatric hospital. Admission on voluntary basis, or the person doesn't know that he requires an admission. Other people will bring that person, so you have to admit. Admission under special circumstances. Reception order on application will be given by a court of law. Reception order on production of mentally ill person before the magistrate. Admission after judicial inquisition. Admission of mentally ill person. Admission of a escaped mentally ill person. In all these 3 conditions, we have to be very careful, and all records have to be maintained properly, and admission have to be done. Discharge of mentally ill person. While discharging a mentally ill person, at least minimum 3 psychiatrists have to discuss, and then only discharge the person. Civil responsibilities of an insane person. Management of property and affairs. That insanity is of such a degree as to make him incapable of managing his personal property and affairs, then the property and affairs should be managed by other person. Consent and contract. An insane person cannot give a consent or sign a contract. Marriage, he cannot marriage. Competency as a witness. An insane person is not a valid witness. Testamentary capacity. It is the mental ability of a person to make a valid will. The requirements are a written, properly signed and witnessed document. The testator must be a major of sound disposing mind. Then only a person can give a testamentary capacity. Force, undue influence or dishonest responsibility of factors should not have been applied by others. Holography, which is written by the testator in his own handwriting. Doctors are called upon to witness the execution of the will of a sick person. criminal responsibilities. The law presumes that every person is sane enough and is reasonable for his actions. And every law thinks that the person knows the outcome of the crime committed and what are all the results of that. The law also presumes that for every criminal act there must be criminal intent or mind. It's called mens rea. An accused, McNaughton's rule, an accused person is not legally responsible if it is clearly proved that at the time of the committing the crime he was suffering from such a defect of reason due to disease of the mind that he did not know the nature and quality of his act. Section 84 IPC. Nothing is an offense which is done by a person who at the time of doing it by a reason of unsoundness of mind he is incapable of knowing the nature of the act or that he is doing what is either wrong or contrary to the law. We need to discuss about Curran's rule, Durham's rule, irresistible impulse test and doctrine of diminished responsibility. These four are very important. McNaughton's rule or Curran's rule, that every man is to be presumed to be sane and that to establish a defense on the ground of insanity it must be clear proved that at the time of the committing of the crime or the act the party accused was laboring under such a defect of reasoning from disease of the mind as not to know the nature and quality of the act he was doing, or if he did know it, that he did not know he was doing what was wrong. That is McNaughton. Now coming to the Durham's rule. According to the Durham's rule, a criminal defendant cannot be convicted of a crime if the act was the result of a mentally disease or defect the defendant had at the time of the incident. Irresistible impulse. In criminal law, irresistible impulse is a defense by excuse. In this case, some sort of insanity in which the defendant argues that they should not be held criminally liable for the action that broke the law because they could not control those actions even if they knew them to be wrong. It was added to the McNaughton's rule as a basis for acquittance in the mid-20th century. Diminished responsibility. Diminished responsibility is a legal doctrine that absolves all an accused person of a part of the liability for his criminal act if he suffers from such abnormality of mind as to substantially impair his responsibility in committing or being a party to an alleged violence. Thank you.